If you are an egg donor and you have been matched with intended parents, if you're a first-time donor, you will first complete a genetic carrier screening, a family risk assessment, and a psychological evaluation. If the results from all of those evaluations look good, the next step is the medical evaluation. So you will go to the clinic that the intended parents are working with for this evaluation. You can probably expect to be there for, I would say, at least 2 hours, sometimes a little bit more, a little bit less. So there are various things that happen during this medical evaluation. One is a urinalysis. So this is a drug test and an STD test. If you are on any medications, they will likely require that you bring the prescription with you to prove that you are prescribed that medication. You want to make sure that if you consume marijuana, you likely want to stop using that probably about a month at least before the evaluation. And of course, they're not going to want you to use that during the cycle. Something else that you will have is an ultrasound. This does not hurt at all. Most women, they barely feel the ultrasound probe, so you don't need to be nervous. This allows them to assess your ovaries, count your antral follicle count, and this essentially means the amount of egg follicles that you have in each ovary. They can also see if you have any ovarian cysts. And it's really cool to be able to witness this ultrasound and see inside your reproductive system. You will also have a blood test, and this allows the clinic to assess your hormones, make sure they are good and ready to start the donor cycle. Sometimes you will also receive a physical. If you have not had a pap smear in the past year, they oftentimes will ask you to have the pap smear with your OBGYN. Sometimes they will allow you to have the pap smear at the medical evaluation, but not often. And then lastly, you will meet with the fertility doctor handling your cycle, ask any questions that you have, just get to know them a little bit. And often you will also meet with the nurse coordinator who, besides your primary contact at your donor agency, they're going to be probably the main person from the clinic that is communicating with you. During this time, they often go over the medications that you will take, show you how to do the injections, see if you have any questions. And yeah, they just want to make sure that by the time you leave, you have a really solid understanding of the next steps and what you are responsible for. All right, so if you have any questions about the medical evaluation, let me know in the comments below, or you can also email me directly at the email provided in the video description.